Good afternoon. Welcome to the Connecting with Patients at Home vignette. Today, we're going to walk through the journey of 67-year-old patient Mrs. Davis, who experiences COPD. She is currently experiencing care from a leading academic health institution in the state of Massachusetts. Throughout this journey, we're really going to evaluate the question of how to provide better, more efficient care for Ms. Davis using the digital tools in an at-home setting. Our vignette will revolve around three major pillars. First, the integration of data sources from all the places Mrs. Davis has healthcare data. Second, using that data to help the clinical care team at University of Massachusetts make better clinical decisions. And third, through an interactive and dynamic patient experience where Mrs. Davis can collaborate with her clinical care team providers. Throughout this demo, we'll walk through a few different steps. First, Mrs. Davis will be invited to join the Healthy at Home program using the My Data Helps API. Second, My Data Helps will integrate with Amazon services in order to create a cohesive and streamlined patient experience for Mrs. Davis. Third, we'll go ahead and connect Mrs. Davis's wearable, claims, and EHR data into one consolidated patient record in Care Evolution systems. Lastly, we'll take all of these pieces, this wealth of data, as well as the interactive patient experience, and help University of Massachusetts make proactive clinical decision making. Just to start off, hi, I'm Thajas. I will be representing Mrs. Davis through the iPhone screen on the right. I will also be representing My Data Helps, Care Evolution, and Amazon through the web browser on this screen as well.
I'm Stephanie. I'll be representing UMass, including our mobile integrated health paramedic service, as well as a company that we partner with called Wellings.
I'm Ian Farquhar representing I2I and I2I Tracks that's serving as the HIE and providing data back to Care Evolution.
So to begin, we evaluate the eligibility of patients who may be a good fit for the Healthy at Home program. So we do this by having a data pull from CCLF, and using this data pull are able to screen eligibility of different patients. So for example, Mrs. Davis is screened and is determined to be eligible. So we go ahead and send an invite to Mrs. Davis. This is done through the My Data Helps API, which can be automated, but we are showing it today through Postman.
Now that the request has been made to invite Mrs. Davis to the Healthy at Home project, Mrs. Davis will receive an email in her inbox that's fulfilled by AWS Simple Email Service. In this email, Mrs. Davis will go through an overview of what the Healthy at Home project is, what they will have to do, and how to enroll in the program. Mrs. Davis chooses to enroll in the program, and when she opens her My Data Helps app, an invitation to join the Healthy at Home program is waiting for her. To accept this invitation, Mrs. Davis will be asked to learn a little bit more about the program, complete a supplemental eligibility assessment, review what she'll be asked to do and what the value proposition is, sign a consent document where she agrees to participate in the program, confirms her contact information, and enters a mailing address where any materials for the program will be shipped to. Now that Mrs. Davis has completed this onboarding process, she is officially enrolled in the Healthy at Home program.
Now that Mrs. Davis is officially enrolled in the Healthy at Home program, she's able to schedule her initial call with the UMass team. So she does this by launching the UMass calendar, which is embedded in the My Data Helps app, and is able to select a time that works well for her to have her initial onboarding call with the UMass team. Once she goes ahead and schedules this appointment, Mrs. Davis's time will be able to be sent back to My Data Helps using Postman. So we do this by first querying for Mrs. Davis in Postman and then sending that information back to My Data Helps.
Now that the scheduling information from UMass's booking system has been pushed back to MyDataHelps using the MyDataHelps API, when Mrs. Davis returns to her study dashboard, she will see two things. First, she will see the appointment time at the bottom of her screen. Now that this data is in MyDataHelps will be able to send nudges and reminders to help Mrs. Davis prepare for her call leading up to the event. Secondly, behind the scenes, MyDataHelps has integrated with the Amazon Seller Central API in order to send Mrs. Davis a welcome kit that contains a Fitbit, a spirometer, and an at-home COVID test. I'm going to hop over to the Amazon Seller Central dashboard, and when I refresh, we'll see that just 2 minutes ago, Mrs. Davis's package has been shipped to her via Amazon. I also want to touch base on Mrs. Davis's dashboard. The same order number is published here so that she may reference this code for troubleshooting and debugging later on in the project. I'm going to go ahead and acknowledge that I've received all the materials to participate in the program. Now I'm going to fast forward to the actual onboarding call that will take place between Mrs. Davis and the UMass Care team. The main goal of this call will be to integrate all of those data sources where Mrs. Davis has healthcare data. First, we'll use the Fitbit API to pull data from Fitbit servers. Second, we'll use a Smart on Fire request in order to get Mrs. Davis's EHR data. Lastly, we will use Blue Button 2.0 to get the claims data Mrs. Davis has with CMS and Medicare. I'm going to go ahead and start the process of connecting the Fitbit device. When I scroll down, I will go ahead and click Connect Fitbit. This launches the Fitbit.com login page where Mrs. Davis can go ahead and log in with her Fitbit credentials. Now that this connection is complete, when I go to the My Data tab, I'm able to see that Fitbit has been added as a linked provider. What's happening behind the scenes is that MyDataHelps is syncing with Fitbit servers and that data is being pulled in. We'll take a look at what this looks like later on. In the meantime, I'm going to go ahead and get started with connecting Mrs. Davis's EHR into MyDataHelps. First, I will add a provider and search for I2I, who is the provider's name in this situation. Clicking this button will launch the I2I login page where I'm able to log in with Ms. Davis's credentials. We're having some HIMSS network demos here, but in the meantime, I'll pass it off to Ian to talk about what's happening behind the scenes when this request is being made.
As mentioned, I2I and I2I Tracks is serving as the HIE and providing data back to Carevolution. The reason for this is I2I Tracks, which you see on the screen, is a full population health solution that brings in disparate data sources. So as the patient is being seen at the clinic or the hospital, the data is found as part of I2I Tracks. And as you see here for Ms. Davis, it's a comprehensive view of her health, which includes problems and medication lists, historical values around vitals and labs and procedures and referrals, but then also encounter information. So as Ms. Davis is being seen by a specialist and being seen by a pulmonologist, that data once again flows as population health inside I2I Tracks, and then we take the data out of I2I Tracks and then send it over to Carevolution via the Smart on Fire.
Now that the Smart on Fire request has been fulfilled by I2I, when Mrs. Davis returns to her My Data page, we're able to see all of the clinical history that Ian just went through from the I2I Tracks platform in MyDataHelps. We can see Mrs. Davis's encounters, medications, and the diagnosis of pulmonary hypertension. In addition to the EHR data being pulled in, we're also able to see that the Fitbit data has now synced at the top of the screen. We can see activity data here, and on the main dashboard can get a more specialized view of oxygen saturation, which is a specialized metric for the COPD patient, Mrs. Davis. Lastly, I'm going to go ahead here and connect the CMS claims data via CMS Blue Button 2.0. When I click Connect Blue Button, I'm directed to the cms.gov login page where I'm able to log in with my Medicare credentials. Once I log in, I can confirm what exact data I want to share, and the FHIR request is sent back to My Data Helps in this connection. We can see on the My Data page that Medicare CMS has been added as a linked provider and that the data is fetching. We'll take a look at what this data looks like later in the demo.
The last thing that we will do on this onboarding call is talk with Mrs. Davis about the WellLinks program. So WellLinks is a company that provides at-home comprehensive COPD care, including virtual pulmonary coaching. So this is available within the Healthy at Home program directly from the My Data Helps app, where Mrs. Davis is able to see additional information and opt into the program. So Mrs. Davis does go ahead and opt into the WellLinks program. Once she does this, she will come up on the WellLinks dashboard so that the WellLinks team is able to see that she has opted into their program and is able to initiate their first call with her, as well as send her any additional materials that she needs to participate in the program. Now that Mrs. Davis is all set up with the Healthy at Home program, she now enters the monitoring phase of Healthy at Home. This includes her continuing to wear her Fitbit, as well as complete surveys, including a daily symptom log. So on this particular day, Mrs. Davis isn't feeling so well, so when she goes to complete her daily symptom log, she answers questions to reflect this. Specifically, Mrs. Davis notes that she's experiencing breathlessness. She also goes ahead and answers some other questions related to how she's feeling, and upon submitting this survey, Mrs. Davis will see an alert that encourages her to contact the Mobile Integrated Health Service. Mobile Integrated Health is a paramedic service at UMass that consists of dedicated paramedics who are specially trained to take care of patients in their home. So Mrs. Davis sees this alert and decides to call Mobile Integrated Health and initiate the relationship with this service. When Mrs. Davis calls the Mobile Integrated Health team, a dedicated dispatcher is able to triage her. While speaking to Mrs. Davis, this dispatcher is able to pull up her health information that Mrs. Davis shared through the My Data Helps app. So this includes her Fitbit information, as well as health information from her EMR and from claims data. On the call, by looking at this health data, as well as speaking with Mrs. Davis about how she's feeling, together the dispatcher and Mrs. Davis determined that at this moment she does not need paramedics to come to her home, but they encourage her to take an at-home COVID test, which she received in her initial welcome kit. Additionally, the dispatcher lets Mrs. Davis know that they will continue to monitor her, and if they notice any additional decline, that at that point they can go ahead and escalate her level of care.
Now that Mrs. Davis gets off the phone with MIH, she's asked to utilize that COVID test that was shipped to her in the welcome kit for this program. She completes the test and comes to the My Data Helps app to record her test result. In this case, it was a positive test, which explains some of the breathlessness Mrs. Davis was experiencing and serves as a trigger for the MIH team to more closely monitor Mrs. Davis over the coming days. The next step is Mrs. Davis is recommended to report her test to the public health department. When she clicks report test result, she's able to provide a little bit more insight on which test she used, when the test was taken, and additional demographics. What's happening behind the scenes here is that My Data Helps is sending an HL7 message to the APHL HIMSS platform utilizing the RADx Mars program. I'm actually going to hop into the HIMSS platform right now and refresh. We should see that a new message comes in with Mrs. Davis's new public health report. Now that APHL HIMSS has received Mrs. Davis's report, they're able to forward this message on to HHS or local public health departments, depending on where Mrs. Davis lives. Now, I'm going to fast forward a few days during which Mrs. Davis has actually experienced a decrease in her oxygen saturation that's been picked up by the Fitbit wearable device she's been issued through the Healthy at Home program. For this demo, we're unable to inject Fitbit data manually into the Fitbit API, but we are going to be able to show you what happens when low oxygen saturation is detected by utilizing the Apple Health Kit integration with My Data Helps. I'm going to move over to Apple Health and add a low blood oxygen saturation level of 80%. Once I add this, My Data Helps picks up that message and will issue an oxygen saturation is low warning, which triggers MIH to escalate Mrs. Davis's condition.
Upon seeing this drop in SpO2, the Mobile Integrated Health team is able to see this as an alert on their dashboard. Specifically, the Mobile Integrated Health team will see Mrs. Davis in a section of their dashboard that notes patients who are experiencing low SpO2 levels. So, upon seeing this, and based on the previous conversations that the team had with Mrs. Davis and other health information that they have access to, the Mobile Integrated Health team makes a decision to dispatch paramedics to Mrs. Davis's home proactively. They're able to send these paramedics to her home, where they're able to treat her at home and actually are able to prevent an emergency room visit.
So through this journey, we've been able to see how Mrs. Davis is able to utilize an interactive, dynamic patient experience to collaborate with her caretakers at the University of Massachusetts to actually end up making proactive clinical decision making. But what we also want to talk about here is how all of that collected data, the wearable data, claims, EHR, and even patient-reported surveys that Mrs. Davis enters can be exported back to the UMass team for further analysis. Care Evolution can take all of this data and perform standardization, term mapping, and normalization of that data, and will export it back to the University of Massachusetts via a bulk FHIR export. UMass is then able to take this export, convert it into other formats like OMOP, and plug it in to an off-the-shelf tool like Tableau, where they can not only get the patient-level analytics that we've seen in this journey, but also the population-level analytics of all patients within the Healthy at Home program. Just to summarize here, I wanted to show how a wealth of data in one consolidated record can be paired with interactive, dynamic patient experience and collaboration to help the UMass team make collaborative, proactive decisions on behalf of Mrs. Davis when she herself may not know that she needs care or be in the position to make those decisions herself. In reality, a version of this Healthy at Home program is actually live at the University of Massachusetts with 60 participants already enrolled. And it shows how we can connect all these different pieces of infrastructure to create something that wasn't possible before. Thank you for your time. Happy to answer any questions.